It's that time of the month. The time when a woman starts to hide, feels shameful and impure. The time when she's on her period and she knows what this means for her. That she would have to manage her blood somehow. Either use the rags at home or send her brother discreetly to purchase pad packets from the local chemist shop. She would then have to quietly change them in the corner of her room in her house in the slum, and then throw them out of the window as if nothing happened. And then when she and her brothers are to go to school together the next morning, she realizes that she could stain her skirt, and then everyone in school would laugh at her. So she decides not to go at all. Her brothers go to school and they continue going every month while she sits at home. She doesn't even know why she's bleeding every month. Is it because she's impure? Has she done something wrong? She starts blaming herself for it. Already, she's being left behind. She's forming part of the next billion women in the world group that is being left behind. Those that have just so much catching up to do. Imagine now that if two people are running a 100-meter race and one starts 10 meters behind the line with more hurdles placed on the way, it is easy to see who's going to win. Unfortunately, that is the plight of many girls in India today, particularly so for the invisible girls, those who are left out, those with little opportunity and without the basic amenities to live by, like stable shelter, toilet, clean water, sanitary pads, decent schooling. So how do we get women who are starting at that 10 meters behind line to the 100-meter line? How do we lift these women up and then help them prosper? Since I was 15, I've been working with girls whose stories have haunted me, angered me, and urged me to do something about it in the urban slum communities. Everywhere I went, I realized that women were being held back in slums, in villages, in all kinds of communities. I was in a village in Raigad district in 2013, somewhere it is a district near Mumbai, where I was staying for a couple of months trying to understand how the village norms worked and trying to work with the village panchayat to get toilets to their homes. The sarpanch then was a woman, a beneficiary of our sarpanch law that mandates a woman sarpanch in the village every 10 years, and she had 5 children. She had 4 girls, and then the youngest one was a boy. And of course, they kept having children until they had a boy. So I asked her why that was, and she said, "My son will take care of me when I am old. The girls will go away to their in-laws." I heard versions of the story constantly. Women were being made to pay the price of an age-old tradition that makes parents, even subconsciously, invest less in their daughters, knowing that benefits from investing in her would be reaped by the family she's married into and not to themselves. But investments early in life, as we all know, determine potential for the girls for years to come. And it seemed that cultural norms and traditions were holding women back at that negative 10-meter line. And unless we started to see their worth, see women's worth, see their economic value and their benefit to society and the household clearly, it was unlikely that things would change. Now today, less than 23% of Indian women are employed formally. And this statistic is even lower in urban areas and actually quite falling. So women are already not employed much. We can't afford further joblessness. This would have huge repercussions on our economy. Our women have as much potential as women around the world, but it is unrealized. It goes wasted because their skills, their low skills, are no match for the world and of the future today and in the future. So what we need to do first is to bring these women with incredible potential at par with others in their generation around the world. We need to support them to be at a fair game. That is first providing them with the basic amenities they need to grow, the tools that they need to understand how to learn and how technology works. But teaching girls in slums about technology when they don't have access to it and are falling sick all the time, and they don't have a teacher or school to go to, or have toilets to relieve themselves, or have pads to use, then we are not playing fairly with them. Of course, they won't be able to pick up the skills as well as someone who has the basics taken care of. So we provide better learning environments and then watch as they take flight. So we need to first provide them with these basic amenities, and then 2, we need to skill or reskill them. We need to help them adapt to technological advancements and use it for their benefit. We've seen people in slums in Nairobi in Kenya and in Rio in Brazil who are getting online part-time jobs, and they're able to use them to earn their way out of poverty entirely, moving out of the slum. It is possible to use technology to shift incomes upwards, and do this not just for the white-collar workers, but also for the blue-collar jobs. If instead of training our women in manufacturing textiles alone, or in similar such industries which we know that machines are soon likely to take over entirely, we need to train our women in communication, leadership, and judgment and thinking skills and vocational skills of the future. Technology will actually allow women to take up jobs with flexible hours where they can balance work and home, which is not possible today in the slums. So after a lot of years of learning, being an activist, lots of listening, I founded Mahila, an organization to get girls and women to speak up like the chatty Myna bird, speak up against cultural norms and taboos, and be able to use opportunities to succeed in life. All our efforts try to push the needle and handhold women from this -10 to baseline when they are more ready to take on their peers, both other girls and boys, and compete at par. When women and men can stand at the same baseline, men respect women as their equals. And most importantly, women have more courage to evade the additional hurdles on their track and remove these hurdles for other women permanently. I want to give a simple example here. At Mahila, we started to notice that as women started to come to our women-only centers and get pad packets from us or buy underwear from us, they would be very open about it while they're in the center. They'd feel safe, and they'd be very open about what they're saying and how they're messaging. But when they start walking back home, they would still wrap up their pad packets in their dupatta. We never gave the pad packets to them in layers of newspaper or in a black bag that they would normally use to cover them. And so the girls would feel kind of exposed. And they'd feel like, no, this is beyond my dignity. And we kept asking the girls to be comfortable carrying them around publicly without shame, but they just couldn't get themselves to doing it. That pervasive idea that a woman could be caught carrying pads was such a matter of dignity that unknowingly women were being held back structurally by societal norms. And we don't even realize it, how many such norms are holding us back. So at Myna, we then decided to design our pad packets to look like bread packets. And we told women to think about them as if they're carrying some regular grocery like bread. And women actually started to feel more comfortable. They started carrying it more publicly and more openly. And at first we thought maybe it's just going to be with our pads then. But we slowly started to see that once, as the women are starting to get exposed to this concept of carrying pad packets openly, it breaks the ice. It exposes them to a new norm, that now they're comfortable carrying any pad packet publicly. The change happens. This change happens over time. During our health education sessions at Myna, we often asked the girls whether they thought that boys would hide pad packets the same way that girls do if boys had periods instead. And they all said, unanimously, no, of course not. Boys would never hide. And that's when we realized together, it really wasn't about a period. It wasn't a period thing. It was a girl thing. It was because a girl had periods that she was ashamed. It wasn't that a period on its own was shameful. And that is an important lesson. It's about making a woman confident in who she is, giving her exposure to facts, to accurate information and different norms, where she can then choose which norm she wants to live by. making it her own decision. That would get her to the baseline. Now, unfortunately, during COVID-19, we've learned a lot of lessons where actually we've seen that women have been pushed even further behind -10 to -15. They're suffering increased violence against them at home. There's worse mental health, physical outcomes. There's higher burden of childcare. There's more homeschooling. People are losing jobs for themselves and their families. And so this pressing time really calls for pause and reflection around women's health, work, and well-being, followed by clear action. What is that 100-meter mark? What is that finish line for the women's health and work agenda for the time being? What are we all racing towards? These are critical, grounding questions for us at Mahila. Mahila Foundation has just completed more than 5.5 years of service. And during this time, we've achieved some, we've failed some, though always learning and improving. We've reached more than 500,000 women at the doorstep in schools and colleges and slums, providing menstrual hygiene products, education, and awareness across some of the most dense urban slums in Mumbai. We've supported more than 5,000 particularly vulnerable girls, where there are girls who are orphans, single-parent households, long-term illness patients. We've helped these girls through their menstrual cycles with products, knowledge, and mentorship. We've launched pad parades where girls, women, boys, and men parade the streets of Mumbai, chanting slogans to debunk period taboos and to encourage chemist shops and shopkeepers to stop wrapping pad packets in newspaper. We've employed women whose lives have been transformed, going from really not being able to see a future for themselves and keeping locked at home to now feeling restless to get out of the house and do something. We've encouraged men, worked with so many boys and men who've become our male champions for this cause and are supporting other women get on board. Other men get on board. We've met the Queen. We've been to the royal wedding. We've been supported by Meghan Markle and Prince Harry. We've been awarded by a couple of different recognitions, all of which have really helped share our story to inspire others. Even during the pandemic, we've continued providing service, furiously fighting for women's rights. We've helped create permanent behavior change, mindset change, and attitude change. And perhaps that's what we're most proud of. There are, and there will continue to be, times of failure. When girls we support aren't able to come back to us, when they're married off and we see their futures withering away as we stand helpless. When we struggle to gain community trust, especially from religious leaders. When we feel we have failed our women, as we get shackled by resource constraints ourselves. Where no matter how hard we try or how much we want to do things, we just sometimes don't have the capacity to do so, or the skills, or sometimes even just systematic support. This is a winding road, and we knew that going in, that the problem of women's health inequality and work inequality cannot be solved by a single organization. It needs to be a movement. It needs to be a sectoral change, and it humbles us to just see how much more this movement has to accomplish, and all of us together. But in all that we do, at Mahila, we have learned so much, and we have improved what we do and how we do it, so we can serve better and serve as a springboard for other organizations. It wouldn't be progress if Myna was still doing today what it started doing in 2015. Over the next 5 years, Mahila will divide into 3 distinct but interconnected divisions, all enabled by technology solutions to help us reach women from their homes, in addition to reaching them through our women-only centers. Myna Health, Myna Employ, and Myna Research are 3 verticals. Myna Health pushes women from this -10 meters to 0 meters, the baseline, and then aims to reach and shift health behavior for 2 million women over the next 5 years. Myna Employ creates further employment and entrepreneurial opportunities and provides skilling for women, including home-based gig economy jobs that are propelling women from the baseline towards the finish line. Myna Research develops a strong impact evaluation arm to Myna's other 2 units and pilots experimental, audacious programs. And there's a lot that we can do, you and I, to ensure our people are future ready. I appeal for volunteers to spend time and resources to train the unskilled. Let's help technology lift everyone up. We need to make sure that those left behind today are not left behind tomorrow. We need to create jobs for the future, for the women who have immense potential and are ready to exercise it. Let's build the platforms to get them to that 100-meter line. So at Myna Mahila, we are trying to make our women future ready. We urge you to think about how you can use your talents and skills to make the next generation future ready too. Imagine if your company's employees spent 100 hours of their time every year helping reskill people, reskill women. It would be a massive undertaking with long-lasting impact. Let's pool together our skills and knowledge and volunteer our time to reskill and upskill our women. With a focus on women, we would change the paradigm and inspire women to take on non-traditional roles. Yet, we need to be providing jobs for the future. But now we need to do it in simple steps in India. It starts with helping people to come to the level playing field. It could start with providing a woman with a single pad, a single toilet, an hour of your time reskilling. Lifting women up is an audacious dream. In 2020, unfortunately, it really shouldn't be, but it is. I'm excited though that today we are here building a community to discuss just what we are aiming for and actively accounting for how this pandemic can alter our goals. But if we know where our girls are standing and that the first goal is to get them to that baseline and that our final goal is then to get them to that 100-meter mark on the racetrack, I'm convinced that we can create a world where she has the courage to take charge of her body, reveal the fire in her eyes, and take the world by her force. This is important because women matter. They matter for you, for me, for your family, your society, the economy, and the world. So let's do it. Thank you.